Greetings, everyone. Welcome to our exclusive Global Leading Voices webinar campaign. We are delighted to have you join us here today. Please be informed that if you have any questions during the presentation, you may type them into the question box in your control panel. The presenter will answer your questions at the end of the presentation accordingly. Now, without further ado, we will turn the time over to our presenter, who will begin shortly.
Thank you so much. It's a pleasure to be able to talk to you all today about ISO 45001 key implementation steps. As a safety professional that has almost 30 years of experience of international health and safety management systems, I find when a new standard comes forward, we're always questioning, what do we need to do? What do we need to know? How are we going to make this work? Is this an option for us? So it's a pleasure to be able to talk a bit about the standard from my aspect, from my background, to say this is where I think that you can go and how you can utilize it. As a safety professional, when I look at safety management systems and how we implement the tools, the standards, put together the culture that's necessary to have safe, sustainable business at the end of the day, has to be strategic. Dan Peterson, who is a health and safety professional who practiced in the United States for a period of time, over 40 years, put together this schematic, which basically says that you have to have a combination of good structure, policies, procedures, standards, program elements, and culture, which is how people do things when no one else is watching, in a good systematic way, so that no matter who, the population, who you put into the workplace or what situation you put them in, they can take a look at the hazard, the risk, the right control within the whole system to have safe, sustainable business. And I truly believe that standards like 45001 can help us not only visualize, but be able to implement such a structure. So some of the reasons for looking at 45001 is definitely that business value and a safety focus, because we know if we have a good safety management system, we can decrease the chance of injury and illness and ill health, as well as property damage and disruption to our business. We can decrease the risk that's associated with the functions that we do within our organization, so that moms and dads and sons and daughters can go home at the end of the day. But also looking at a larger business value. If we look at health and safety aligning with business overall, and 45001 outlines ways that we can do that, where we're looking at assimilating organizational culture in a greater way, that we're looking at concepts, sustainability and supply chain management, all types of quality and organizational initiatives within the workplace, and aligning them so that we're not having a duplication of effort or services, but marrying all the components and strategy within an organization to take it forward. 45001 also emphasizes that leadership and engagement, the corporate responsibility necessary for an organization to fully implement a safety management system. And it outlines who needs to be doing what, roles and responsibilities, support and competency, but also outlines that people need to be held accountable to ensure that whatever plan we put in place is completed, that it's done. 45001 also addresses brand issues. So if we have a good safety management system, accidents and incidents don't occur, we definitely look better out there in the business world than if things are happening within our organization. 45001, as well as having a good safety management system, decreasing injuries and accidents, gives us that competitive advantage that we need to go forward. It also helps motivate our employees and even is tied to retention of employees, because it shows that we care where they are, what they're doing, and their health and safety within our organization. So there's many reasons why 45,001 is a good thing to look at, to implement within our organization, and gives us a template to which we can formulate our strategic plans, our vision, our plan, so that we can make sure that safety is taken care of in our organization. Sidney Decker had said that the old view of safety is the absence of incidents, but the new view is the emergence of this property of the system and a life cycle within an organization. And I look a lot at LinkedIn and safety forums and at different safety conferences, and people say, well, you know, we haven't changed safety in years, and what we're doing is not effective, and we're just doing the same thing over again, but renaming it something else. I think with 45,001, we can look at that basis of a structure that has a lot of the key components that we've often looked at in singularity. And we said if we just focus on risk, hazard identification, risk assessment, and control, then we'll go forward with safety. If we focus on leadership or engagement, so we've often taken bits and pieces and not really looked at it as a whole system. 45,001 allows us to have that foundation of a whole system with all the components that are there. So just a little bit of where we're at with 45,001. It's been a long journey looking at health and safety management system standards. We see that in the early 1990s is when there's been a lot of conversation going on and some of the first standards being published globally. And again, it was very geographically regioned. So we often saw that the UK would focus on something, and then Canada through Z1000, ANSI Z10 in the United States. That 18,000 started to get more traction within the middle 2000s. And the last couple of years, there's been the focus on the 45,001. As of this year, there has gone to a second draft, and so on a lot of our documents, you'll see 45,001.2, which means that it's gone to another review and consultation and will be taken forward again this fall to be have the final review and voted on and hopefully approved. So we're looking at a finalized timeline of 2017 as a final draft and hopefully approval. And if there is any changes that need to be made or tweaking to be made, then the timeline will probably go into the end of Q2 in 2018. Just to let you know where things are at. So 45,001. The proposed is to have that as an international organization standard. So it would be in the family of the 9,000 and 14,000 quality and environmental, so that it would actually be an ISO official standard in place and not just a guideline that was there. It has each of the components that all the ISO standards have and follows the same format within the draft and the potential approved document. So an ISO standard is developed by a panel of experts with technical committees that are geographically based within the case of 45,001. So there's mirror committees that are around the globe. Once ISO has established that there's a need for a standard, then these experts meet and discuss and negotiate that draft. The draft is then developed and shared with a larger group of members who are asked to comment and vote on it. And then if that consensus is reached, the draft becomes an ISO standard. If not, it goes back to the technical committee for further efforts. And at the moment, that's where we are with 45,001.2. The great thing about the collaborative approach is we get many health and safety professional opinions from around the globe, so that we're looking at a system that works no matter if you are located in one geographical location or you're a multinational organization, and has considerations of that global concept. So again, the final draft approval we're looking at within the end of this year. And just again, for information purposes, we've got 53 countries participating and 16 countries are observing So just the timeline. So great, we're going to have a standard. Now what do we need to do to see if this is what we need to have? And if we decide that this is what we need to have, how do we implement it? Well, it's just like any other program or initiative that we want to put in place. For our health and safety program, we need to look at where we're at, where we want to be, and how we need to get there. So at a very high level, I believe that we need to get management system savvy, understand what 45,001 has, compare it to what we have already within our organization. What is the standard that we have implemented to, if any? We need to start discussions with others in our organization who have ISO system experience. So if we already have certification in 9000 or 14,001, we can definitely rely on some of the information from them of how they've implemented things, what process and plan they utilized, what were some of the barriers and some of the successes, so that we can learn from them and put that within our plan. And we need to know what are the tools in our toolbox to get us there. Change management, I'll talk about in a minute a little further. A gap analysis, how we're mapping will determine how we need to go forward. I truly believe that you have to understand where you are and the system that you're putting in place to put an effective plan together. So I'd like to talk a bit about some of that now. I also believe that you have to understand and implement some of the what I call new requirements that are there. There's a couple components that have bumped up or gone beyond some of the existing standards, such as CSA, Z1000 or ANSI Z10, in what they mean when they talk about context or leadership, risk, participation, and culture. And I'll talk about each one of those in just a moment. I'll also give you a list of some of the changes of the documents that you may need to have to reflect some of the new requirements in the system, so that you can also check with that to where you're at and what you may need to develop. And I also believe that you need to review the effectiveness of your current control strategy and make the changes that are necessary as you're going forward. So it's a good opportunity to again review our job safety analysis or our workplace hazard and risk analysis to say, well, here's the hazards with the tasks that we have, here's the risk associated and the controls we have in place. Is it sufficient? So we need to become management system savvy. So what does that mean? That means that we need to know, if that we choose to go down this road, what does that mean for our organization? What are they asking us to have in place? So you need to get a hold of the document, the draft document, and you need to compare it against other standards that you may already have implemented your program to. An example of a standard that some organizations have developed their existing programs are to the International Labor Organization 2001 guidelines. In other organizations, it may have been to the Z1000 or ANSI Z10. So no matter what system that you choose, as an example of the CSA Z1000, since I'm from Canada, is that when you look at the table of contents there and you compare it to the table of contents of 45,001, there's going to be some similarities and there's going to be some differences. There's going to be some names that we see that are similar and others that may have different semantics. So we need to know how that compares. 18,000, some of you may already be to that level, and I truly believe that if we have one of these safety management systems in place, or based upon already, specifically 18,000 series, that it's going to be easier to go into 45,001 than if you do not have a template that you've been utilizing. So international standard specific requirements, it has its guidance outlined for us for our use. It does not state specific performance criteria or detailed specifications for the design of a management system, but it gives us the template components that's necessary to say these are the things that we need to have in place. How you work to fulfill that will be specific to your organization, its workflow, the tasks that are done, and so forth. So draft table of contents, I know it's very small in your slide, but it's more for the visual of it. They have gone through, and just like all the other standards, listed for easy reference into topic areas what's necessary. You can take that table of contents and look at the other pieces of your safety management system and start to compare. What do I have that's listed within it, and what do I not have? For me, this is the main aspects of the table of contents: scope, normative references, terms and definitions, context of the organization, leadership, planning, support, operations, performance evaluation, and improvement. You'll notice within this diagram that we're using, again, Deming's Plan, Do, Check, Act, which all safety management systems in the recent 20 years have been based upon. And you'll see where specific components of the 45,001 can fit within each of the aspects that are there. The circle or the square that's outside of the Plan, Do, Check, Act is the scope of the management system. So our organizational system that's in place is the structure within all of these activities take place, and the consideration is there. So you can take each one of these components, and as you start to do your gap analysis, start to map what I have in comparison to it. There's a lot of different references that are out there. You can do it yourself by, here is just the table of contents for 45,001 and holding it against the CSA Z1000. There's a lot of education and program components that are out there that can help you map things or can train you on the specific differences that are there. Here's just comparing the ANSI Z10 to the components of the 45,001. Just want to bring your attention to the number 4, context of the organization, which is a real new concept when you compare it against many of the safety management systems that are already out there, that they sometimes talk about it within some of the other elements, but not highlight it to the point that 45,001 says that you need to look at the context of the management systems that exist in your organization. Otherwise, you'll not truly implement a great system that will get the results that we need. Here's a document that I've just kind of provided for you. Again, a very high level of 45,001 to the 18,001 comparison. You'll see that there is some gaps on the 18,001 side. I wanted to point to 4.2 and 45,001 and 4.3, where it talks about understanding the needs and expectations of interested parties and determining the scope of the safety management system. Is not specifically mentioned in 18,001, but is a greater consideration in 45,000. So compare what you have with what you need to have. I wanted to highlight also a couple of the components that I think are expanding or that are unique to 45,001 that we need to consider when we say this is the direction we want to go in and what would it mean for our organization. So clause 4, point 4, the context of the organization is an important one. As I noted earlier, the 18,000 series as well as the ANSI Z10 doesn't specifically have information or component on this where 45,001 does. Basically, it's meaning that we need to understand the organization and its context, because if we do not truly understand how all the other systems are functioning within the organization and identifying all the key stakeholders and their specific requirements, roles, responsibilities, and even accountability, that if we're not including all the activities and products and services within the control of the organization, then we truly only get partial implementation of our safety management system. And we need to be considering the whole global aspect of the organization, how it works, how people's roles are in play, to make sure that our safety management system reflects that or works within it to get true implementation, maintenance, and achievement. So the key theme then is know your organization's environment inside and out under which it operates its health and safety management system and manages its safety performance. Again, over the last 30 years of my practicing health and safety, I think I've been at fault for this, and I know that definitely some of the other organizations that I've worked at is sometimes within our safety profession we get our blinders on and we see our own little world and we think of ourselves, and we sometimes don't expand that into the larger global aspect of the organization. And this is just saying that we have to take those blinders and peel them back and look at the big picture. So again, making sure that we have the structure component, the policies and procedures, but also the cultural component. How do people actually work within the organization when no one else is watching, when people are watching? So looking at the grand scheme of things. Clause 5 talks about leadership and has a greater emphasis on it than probably the other standards that are out there. A lot of the other ones mention it, talk about it, but there is a huge focus about it starting at the top and infiltrating through the entire organization. But it outlines specific activities, roles that they feel that top management should play, that there's a greater role in the whole approach. So they want to make sure that top management demonstrates leadership and commitment through policies, integration within all business processes and aspects of the organization, that there's the resources and the support for everyone's roles and responsibilities, and ensuring knowledge of the organization's context, risks, and its safety management system components that are there. So the application is to everyone in the organization, and not just certain levels within it. So the key theme is that top management are very active participants within health and safety, and look for set targets for specific meetings that include health and safety within them. So it's not just a report that's put on a desk and someone has time to read it, that it's an active discussion that occurs. And that a leadership aligns the organization to the system so that they are aware of the components of the safety management system and how it works throughout the organization. Planning within point 6 is emphasized. Planning is critical to managing risks and opportunities, and that again it has a consideration for the context of the whole organization and the requirements of all interested parties that are there. The plan also has to have a key component that there's an assurance that whatever safety management system component or initiative or plan we put in place, that it meets its intended outcome, that we have the right priority assigned to it, that it's based upon the level of risk that may be there, and that there's always a continual improvement process within that consideration. So the key theme is, if you have this hazard or risk potential, you have it or you potentially have it, you need to start making plans. So knowing what the applicable legislation and standards are for it, making sure that we have the hazard and risk measurable, that we have monitoring systems in place, that we have a system that communicates the hazard, the risk, the right controls, and that we regularly review and we update our safety management strategic plan. So again, focusing heavy on hazard identification, risk assessment, and control implementation, which is truly the basics of health and safety. It's getting us in our organization to really look at what are the tools in our toolkit that we're utilizing to identify the hazard, assess the risk, and the right control. And is it usable by everyone in the organization, easily to understand by everyone in the organization. What is our tolerability for risk? How do we quantify as well as qualify what is an acceptable level of risk within our organization? And then if we're saying that it is a certain level of risk, how do we deal with things in a timely manner so that we don't leave the aspects up to so much as people's perception, oh, this isn't that big of a deal, we can wait later, and another person thinks it's a very big deal and we need to deal with it immediately. What are the tools that we're putting in place so that people can have those discussions and agree on the path forward? So again, concepts such as a LARP, how are we defining them within our organization so that people truly, truly understand it on all levels, from the floor to senior leadership? So whatever you call your hazard identification, risk assessment, and control program, whatever we call it, it's about making sure that the hazard is identified, the risk is assessed, and we have the right control in place. So again, picking a tool, making sure that people know how to utilize it, and that they can utilize it at every level of the organization. So whether it's a simplistic matrix such as this, or we want to get something that's a little bit more robust, the 45,001 isn't saying you have to use this specific tool. It is just saying find one that works in your organization and introduce it, implement it, maintain it. Here's just there's many examples of what people utilize, but it's finding one that works for everyone in the organization. Even as something as simple as such as this risk calculator from an organization, again based out of Canada, which can help field level workers talk through a situation and come up with more of a quantitative as well as a qualitative risk level to say, if it's this high, I need to do something about it. If I do these things, it decreases this to this amount. Whether we use hat-on matrices to say, this is what can happen pre-event, event, and post-event, and then what are the things that we need to do to make sure that it's controlled. So using a systematic way to ensure that everything is identified, everything is assessed, and all controls are put into place. I'm finding in a lot of organizations that even have good safety management systems and have a good solid matrix that's there, a lot of times the safety professionals know how to utilize it, sometimes managers and the plant engineer does, but when it gets down to the person at the level of the shop floor or in the office, they don't know how to perform the task. They don't know how to utilize the tool, and sometimes they make that quick judgment. Do we do the risk assessment, or we just get it done because we got to get it done? So make sure whatever tool that you use is well known, is easy to use at all levels of the organization. And whatever works for your organization, whether it's a complex matrix or some simple questions and guidelines to get them to work through the hazard, the risk, and the right control. So planning is not just plans, but objectives and the achievement of those plans. So our objectives and our plans have to be consistent with our policy, our requirements, legal as well as to the standard, and that it's measurable, monitored, communicated, and up to date. It needs to take into account those risks and opportunities, but it also needs to take account that global concept within the organization. 45,001 does talk about that we have to consider, what needs to be done, all resources, who, when, the monetary aspects, what type of competencies are necessary, how will it be evaluated, how is it going to be monitored and integrated into the business units, and then the documented information that's necessary. So again, the key theme with this is what are we trying to do, and that we not only say what we're going to do, but we do what we say. So management systems and our associated policies and procedures depend upon the actions of individuals and groups for the successful implementation. In the past, this is another area that I've seen where there's been some opportunity for improvement within organizations in their health and safety management system, is they often have great strategic plans, they have great action plans, but it seems that the initiative only gets so far, or it's implemented for only a period of time and then it dwindles and it seems to fail. And this is where 45,001 is saying that we have to look at it through its whole life cycle, and how, if it's going to be an ongoing long-term program, how do we engage those individuals and groups that have specific roles and responsibilities and accountabilities within it to get it done and to keep it going. Right. Never mistake activity for achievement is a great statement, I feel, that looks at this planning component, is that it's not about just having activities going on, and but it's actually meeting the goal and the objective that the activity is supposed to address. Point 7 talks about support, the means by which objectives are met. So this is outlining those resources and ensuring the competent people have the awareness, the information, and the tools that are necessary to implement what we've asked them to do. So looking at the competency levels, awareness of the contributions of existing management system components, and where there may be barriers within it, dealing with the lessons we learn from relative incidents that have happened in the past. I think this is going to be a huge component when we're looking at the support that we give frontline supervisors to middle management in their roles and responsibilities within our organization. And I also feel that this is going to have an impact on the safety professional as we define them as a competent person. We're seeing that more and more as safety people, who we have and what we bring to the table needs to be looked at. And I just want to mention that the International Network of Health and Safety Practitioner Organizations, INSHPO, has just released a OHSAS Professional Capability Framework, a global framework for practice for the practitioner to the professional level, that has looked at a very global research base that says these are the abilities, skills, and knowledge that as well as activities and roles and responsibilities of a practitioner at the professional level that we need to have in place. And so I truly believe that as safety professionals and as supervisors and workers and managers, that competency bit is going to become more important as we look at implementing these kinds of programs within our workplace, these kinds of systems. So the key theme for this is being able to implement our strategic and action plan without barriers. And if we have the resources and the components identified that are necessary to do that, and then provide the support and enable the individuals who we assigned it to do, then we should be able to get done what we need to do. We won't hit that wall. Within the support, number 7, it's really looking at that inclusion of documented information required by the 45,001. So appropriate identification and description, controls that are there, outlined standards, description of the management system, control over unintended use and available where and when needed, access for workers to records relevant to their work environments, are some of the components of the documentation and support within that aspect. But there's also the engagement processes. How do we get the information to the worker level? How are we consulting them as appropriate internally and externally? And how are we outlining responsibilities to make sure that the requirements that we've set forward are being fulfilled? So the key theme of point 7 is to really equipping and empowering the system and the individuals within the system to deliver on the performance that's necessary. In the past, I think, again, we've often seen that there's an opportunity for improvement when we look at implementing a full program or even just a program initiative, that we don't often have all the resources that are necessary for the whole life cycle of the project. And we're hoping to do parts of it off the side of the desk in some instances. And within 45,001, they say, you know, that's not good enough. We have to make sure that it has everything that's necessary to move forward. 8 is operations. And this is where rubber meets the road. So looking at the operational planning, implementation, and control processes that again have the flow of hazard identification, assessing the risk, making sure that the right controls within the hierarchy of control is put into place, looking at the emergency situations, what is the proper command and control, enforcement aspects of it, and how is that considered, and then are the components documented. Within this, I see that we really have to look at our concepts of management of change. In this, we have to also include operation functions such as outsourcing, our procurement and supply chain, and there's also an emphasis on contractor management within this component. So the key theme is execute your plans to manage your hazards, risks, and opportunities. Internally, the operations, procurement, change management, and from the outsourcing or the external components, anything that comes from the outside, including contractor management. So again, what are some of the tools in our toolkit? Looking at the basics, again, our hazard, risk, and control, looking in that very global loss control management philosophy. Where do all our hazards come from? If we're implementing a program, what are the hazards and the risks of implementing it? How are we controlling it to go forward? Making sure that we have the best controls in place, and maybe even a multitude of controls to put between us and the hazard to make sure our people are taken care of and the risk is reduced. Right. Considering aspects such as human factors within the whole system to ensure that we're not setting a component up that doesn't work within how people, the workplace, and management interact. Understanding our management of change philosophy within our organization, and if we don't have a management of change philosophy, how can we introduce one and implement one so that we can succeed in going from where we are to where we need to be. Clause 9, the last point that I want to highlight is that performance evaluation and determine what needs to be monitored and measured, including methods, frequencies, schedules, and analysis. So looking at the audit programs and all leading and lagging indicators and such. Implementation of internal audits to 45,001 and organizational requirements, including the auditor selection and reporting and such, is going to be along the lines of all other ISO standards that are there. So you'll be outlining then the requirements that include frequency and methods, actions and documentation for both internal and the external approval process. So the key theme for this section is, again, making sure that we have a checkup. Is it all running right? So it's a check to determine into what are the next act steps. Within performance evaluation, there's a huge component on leadership engagement. So so it goes back to that first key that I was talking about. So what are the planned intervals, as it states that we need to have planned intervals to ensure suitability, adequacy, and effectiveness? How are they reviewing the status of actions from prior reviews? They'll be looking at how do we change and what kind of changes are happening with internal or external issues? How are nonconformities being dealt with? Decisions on new continual improvement opportunities will have, do they reflect a safety aspect within it? And how are they looking at trends and putting a continual improvement process in place? So the system cycle needs to get back into the leadership and new opportunities for the plan. 10, improvement. So that once there's been that review, and again, a highlight with senior leadership, looking at what needs to be done and guiding it forward. Improvement is not about perfection, but the pursuit of perfection. And then the reaction, key component is that reacting in a timely manner to the issues that we see. And how does your organization define what is a timely manner? Beyond higher the risk, do more safety stuff quicker. The lower the risk, we don't have to do as much as quick. Having that more defined than just those statements. So the key theme is ensuring correction of deficiencies and focus on improvement and defining what that timely manner may be. So as we're kind of winding to the closure of my presentation, I did want to just highlight the documents that we need to reflect the components that are there that I see as being a bump up from what we may have with some of the existing ones, 18,000 or Z10 or Z1000 would be in this list. And so we'd see, again, scope of the health and safety management system and the policy. Well, we already have those in my existing program, Eldeen. Why are you mentioning them again? Well, we need to ensure that we have them, but are they also now reflecting some of the components that 45,001 has that some of the others may not, such as that leadership role or emphasis on leadership, active involvement and activities versus just that they're committed to. That goes back into organizational roles and responsibilities, accountability and authorities. Are the legal requirements and other requirements outlined within the aspects and is now reflecting the 45,001. So just some of the documents that you may want to pull, review, make sure that they have some of the key components of the 45,001 aspects. I had a question the other day about the evidence of the results of continual improvement, and just talked to an organization about their CAP logs and what they put within that. And does it have an overriding theme to just safety? Is it with all continuous improvement processes? Does everyone have access to the other ones so that we know that there's not duplication of effort? And how does that system work, and how is it well known? The organization went back and took a look at it and realized that there was a lot that they could integrate so that there wasn't that duplication, that there was a better known process. So what can you do with 45,001? Well, get management system savvy, understand what system you have in place, what you've templated to. If you haven't done to any, then you may have a little more work with 45,001. If you're already at the that ILO, CSA, ANSI 18,000 standard, again, just throwing those out there, it's going to be an easier transition because you're going to be able to map and know what you need to bump up or to develop to the next steps. Check the tools in your toolbox, like your management of change philosophy, and is it appropriate and really fits within the management structure and the management system that already exists globally for your organization, or is it the wrong tool and you need to look at a different philosophy? Make changes to your document system to reflect some of the new requirements. Understand and implement the new requirements of that context and leadership, risk participation, safety culture that we hit the highlights of with 45,001, and review effectiveness of your current control set that's matched the hazards and the risks that have been identified with the tools in your organization, and make the changes as necessary. So you can use systems such as this to have the right structure in your organization, and through that implementation and structure phase, it helps you build your safety culture. And then no matter what person, what situation you put them in, if you've got a good, strong safety management system in place, you can have safe, sustainable business at the end of the day. And that's truly the goal of all our organizations. So further information on 45,001 can be downloaded from various websites that are there, and definitely the ISO org has the catalog and some support documentation. And so my wish for you is that you have a strong safety management system, that at the end of the day, that moms and dads and sons and daughters go home, that we have long journeys called life at a very old age, that we can live them in our head like we live them in real time. My wish for you is that you look at a system that you have in place and compare it to the new ones that are coming out there, so that you can put a plan in place, a system in place, that we can truly be the difference in somebody's life, in an organization's life. And so you can use organizations just like PECB to help you within that journey to be the difference. So Hannah, I'll give it back to you now, if that's all right.
Thank you, Eldeen, for this very informative presentation. Before we proceed with the question and answer session, I would like to inform you that PCB provides training and certification services for OHSAS 18001 Introduction, Foundation, Lead Implementer, and Lead Auditor. OHSAS 18001 helps you in reducing your workplace hazards and also protecting the safety, health, and welfare of the people engaged in your workplace. Also, please be informed that upon the publication of ISO 45001, PCB will offer training and certification services for this standard. A PCB certificate will demonstrate your dedication in implementing and managing these processes and frameworks, and most importantly, you will be recognized worldwide. For more information, please visit our website, www.pecb.com/training. Now, without further ado, we will read some of the questions from attendees regarding today's presentation. The first question is, comparing first draft and second draft of ISO 45001, what are the main changes? And based on your experience in the field of occupational health and safety, do you think that the second draft will be approved by ISO committee?
Some of the major changes have been in some of the verbiage, the semantics, not so much on like definitions of hazard and risk, but within some of the concepts of how it's applied. So I would say that that's some of the biggest changes that are being recommended. Within the hazard and risk identification components, there's been some discussions within that that's there. I know that some geographical regions are more likely to approve than others based upon some of the changes from the first draft to the second. All the changes that are recommended, there's a couple papers that are out there that go in quite a bit of detail that outline the exact, to compare them from point 1 to point 2.
Okay, thank you, Eldeen. The second question is, how can you ensure that top management or leadership is in line with the ISO 45001 standard requirements?
I believe that that's a courageous conversation that you need to have with senior leadership, outlining what are some of the pointed aspects of what 45001 want them to do, having regular conversations, defining what timely manner is, looking at a continuous improvement conversation around the senior leadership table. This is what would need to be done to be able to obtain and to maintain this certification. Then they could have, and telling them how they would be able to do that would be key in making sure that they understand and would agree to it. If senior leadership is not willing to do those things and not to and won't agree to it, or that they agree to it and you know that it's not going to work, that's where identifying how safety management systems have been working within your organization, and if the culture is ready for that change, you might not be ready to implement 45001. Posner and Costner put together a readiness for change matrix that asks some questions that you can look at your senior leadership team with and ask those questions, either to them or in your own head as you're looking at who those players are and what their past performance has been, to say, if we introduce this today, would they be ready for it? If not, then what can I do to get them ready for it? And that this is going to be a plan that's not going to happen within the next year, but in the next 5 years, because we have to give them some tools and get them to a certain stage within safety culture to be able to take that forward. I also think that if you find a champion within your safety leadership team and educate them on the 45,001 system, thoroughly educate them on it and what the leadership team requires, then they'll be your champion for identifying whether it's possible at this moment, what would be necessary to get you to the stage where it would be workable with the team, and that they would also help then implement it when it comes to that stage. But if we don't educate them, we don't prepare them, we don't support them in that role, then it's not going to get done to the effectiveness and efficiency that it should.
Thank you, Eldeen. So the other question is, do you think that ISO 45001 will be more effective than OHSAS 18001?
Any standard is effective to the point of its implementation maintenance. Some of the aspects that 45,001 have that 18,001 don't, I think has the potential to make it more effective. So that identifying of the organizational management system philosophies in its totality, looking at how health and safety is integrated into all aspects of the business and that all aspects of the business, supply chain, contractor management, communication, documentation flow, is key that we haven't emphasized in some of the other systems. And so I think through the emphasis of some of those key components, that one, the leadership one, the assigning of competencies and roles and responsibilities at a higher level than we have before, gives this standard, if fully implemented, a better chance of succeeding than some of the others that are there. We know that certain people in certain organizations need to have a specific structure in place to be able to put a vision and actions into play to make things happen. And if that box isn't outlined for them, if we think that it's just a common sense component that leadership needs to be committed and talk about it, but we don't actually give a bigger picture of what that is, for some people it's not done. So I believe that 45,001 has expanded on a lot of those components, which then brings us back to question number one. Some people are saying, well, I don't want it to be that prescriptive, or that component may be a little more touchier in my geographic region to be implemented, and therefore we don't like how it's worded right now. But I do truly believe that if those are in place, that it will be much more effective than some of the other ones.
Thank you, Eldeen, for your answer. However, because of time limitation, we will only be answering one more question, and the other questions will be answered by Eldeen via email. So the last question is, how can we integrate the newly ISO 45001 standard with other standards?
So I believe by comparing the 45,001 to the standards that we may have in place is going to help us build to the 45,001. So let's use just an example of an organization that I'm working with in North America. They have already mapped their safety management system to both ANSI Z10 and CSA Z1000, which are very, very close in its inclusions because they operate throughout all of North America. They've been looking at the 45,001 draft to bump up their system, to be able to say, you know, we meet these geographical voluntary guidelines in place, but we also meet with the potential to grow and to meet the 45,001. 45,001 has more components than some of the others, but it has all the components of the others, if that makes sense. So if you're meeting the 45,001, you'll be meeting the other safety management system standards that are there. So so then how do you integrate? By integrating, may just very well be that you are just brushing up or tweaking one of the components that you already have in place, and it meets all of the standards. I hope that made sense.
Okay, so thank you once again for this presentation, Eldeen. It was an honor having you as a presenter. I would also like to thank all the attendees for taking the time out of their busy schedule and joining us. Please be reminded that this webinar will be recorded and posted in our YouTube channel and also in our SlideShare account. We hope you enjoyed the webinar, and we wish you a wonderful day.